Appalachian Wellness, for a new tomorrow and a new you. I'm Raymond Owenbrink, President and CEO of Appalachian Wellness here in Nashville. You can follow us on social media. We're going to talk about replacing low vasoactive intestinal peptide using the nasal spray to correct the abnormalities, the imbalances, and help to restore normal health after an affected CIRS attack. Let's not kill the golden goose by using VIP inappropriately. This is the biggest advance ever in the treatment of SIRS. It has many amazing, almost magic properties. The FDA has designated VIP as treatment for pulmonary hypertension only. Now, pulmonary hypertension can occur from CIRS, so if you've got that, unfortunately, it tends to be a one-way terminal illness, but it can actually be reversed with the use of VIP. Even without pulmonary hypertension, though, this drug works amazingly well for SIRS. It downregulates MASP-2, the C4 activator that causes C4A formation. It restores the balance of vitamin D3, downregulates the aromatase enzyme, which breaks down testosterone, among other hormones, raising the testosterone and lowering the estrogens. It upregulates, increases the low levels of VEGF. If lactose, fish oil, omega-3s don't work, VIP will correct the low VEGF. It restores the diminished VO2 max. I can't talk about this one enough, especially with somebody with pulmonary hypertension. They can get short of breath taking a shower. Halfway through the shower, they have to stop and they're panting just to try to catch their breath. I mean, it's a miserable existence. You start these people on VIP, and all of a sudden they can breathe better. And things that used to wear them out, leave them breathless, walking 100 feet down a hallway, all of a sudden they don't think about it anymore. They can just get up and go. It's just a miraculous drug. It reduces the shortness of breath not only on exertion but even at rest. And when you've got shortness of breath at rest, by definition, that's New York Heart Association stage 4 congestive heart failure. That's really a bad prognosis when you've got that. It also has immunoregulatory effects. This is actually a neuroimmune, a brain endocrine, immune system link. It improves thinking problems. It drives up the CD4, CD25, and FOXP3, which helps to turn that off switch back into action again when the immune system is activated. It reduces joint stiffness in about 10 minutes due to endorphin release. Pain just suddenly diminishes immediately. It improves exercise tolerance. It causes a global improvement in all modalities. Typically, within 5 minutes of the first dose, patients can take a deeper breath. Joint symptoms at baseline. They may have tight, clenched hands when they come in, will typically open up and relax when you started on VIP. This immediate pain relief cannot be overstated. It is a huge thing. It's a big deal, and boy, the patients will love you for it, and they'll follow you anywhere. Cognitive issues, unfortunately, don't respond quite as quickly. If there's a sudden increase in TGF-B1, there probably has been recent exposure to a new source of toxin causing, cytokine storm, and you've got to go back to square one again. So keep an eye out for that. If this TGF-B1 usually goes up real bad all of a sudden, typically also the visual contrast sensitivity effect will plummet, and those are good indicators that you've got a new problem on your hands. VIP 50 micrograms 4 times a day corrects the paradoxical rise in the pulmonary artery systolic pressure that occurs with exercise in days, not weeks, with durable effects with titration over time to twice a day, and over further time it's possible to actually stop the use of the VIP as long as you don't have any re-exposure. If there's re-exposure, again, everything goes back to square one. Warning regarding the VIP. It can cause the lipase to increase a bit, so it's important to measure baseline lipase and then monthly, and also measure some VO2 maxes if you can to see how well they're burning oxygen. Draw blood at baseline, lipase, TGF-B1, C4A, and VEGF, and then give the VIP. Repeat to draw the VEGF, C4A, and TGF-B1 in 15 minutes. And get a monthly monthly lipase, because again, you've got to watch out for pancreatitis. If you do get pancreatitis from the VIP, it's got to be stopped, which the patient won't be real happy about, but pancreatitis can also be a lethal illness. And don't forget to check that lipase monthly while they're on the VIP.